All right, day 5 of the 27-day mobility challenge here at the Reprogram. So we've kind of gone through our whole upper body active standards. You had a much better idea of the state or the capacity of your upper body currently, and then the next 5 days we'll go on to the lower body standards, okay? And these tools are mainly used as a screening tool. They're not necessarily used as the tools that you would improve your mobility with, okay? So the first, we've pretty much covered most of the upper body. We've done the shoulder flexion, external rotation, extension, internal rotation, the thoracic extension and rotation, and now we're going on to the last segment, which is the lumbar spine. And what we're really looking for here is to see whether you have a really nice amount of spacing between the lumbar discs, the intervertebral discs, a nice amount of decompression, nice length in the QLs, nice length in the obliques, nice length in the lats. And there's a lot of signals in this particular movement that are going to give it away if you are missing those, okay? This is quite a unique one. I'll kind of save the best to last here because the majority of you will need a partner or a friend to assist you. I use, or if you go to the gym, use a 20 kg weight plate. I use a 20 kg weight plate. You can use a 15 if you want, but something heavy enough to anchor you down. So you'll see what I mean when I demonstrate it. So let's continue, and I'll put you down, and I'll show you how it's done. All right. So this is called the leaning lotus, all right? So the first part of this movement is to actually, you're going to need some hip mobility to actually access this correctly anyway, okay? If you don't have it, don't worry, I'll show you the progressions to work on it. But the first thing you're going to do, the first position you need to access is the lotus position. I said leaning lotus because obviously that in yoga you do a position called the lotus. It's sort of like this. So I guess this is a half lotus because the other foot would come up through, but that doesn't matter. Now you're going to need to anchor this leg down because what we're going to do is we need to have our lower back, upper back, mid back, upper back, and back of the head. Interlace the fingers. Fingers go behind the head. Elbows are up on the wall, and nothing in the upper body leaves the wall until the movement is done, okay? We do not break this position. And what you're going to do is you're going to lean over to the side, and the idea is to get this elbow to touch the floor without this leg lifting up, okay? So obviously, even if you can touch the floor, this leg's still going to lift up because of the way the weight transfer is going. So at the minute, I don't have a weight plate with me, but I've kind of makeshifted an idea of putting two 10 kg dumbbells on my leg. But I certainly prefer using a plate because this might all fall to pieces when I do it. Okay, so let's see and hope that this works. But usually you'd have a friend, a gym partner, a training partner, family member, friend, putting their weight, a hand on this knee, allowing you to rock sideways, okay? And what we're doing is we're basically testing the length of this lateral compartment. We've got the QL muscle here, the obliques, the lats, and particularly when on our shoulders are forced and external rotation here, when we start moving, one of the most common signs is to see this elbow break away because they don't have the length in the latissimus dorsi to actually get down there, okay? So it's a really good diagnostic tool, screening tool, and you can actually use this movement to actually improve this pattern, okay? So I'll demonstrate it first. So this is what I say optimal mobility, particularly in the lumbar and the obliques, and this will also help with rotation as well, but this is what I'm looking for when I use it as a screen, okay? So we're going to leave, everything's on the wall, we come down, 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 and then this elbow touches the floor, and that is a pass, and then I use the weights to pull myself back up, okay? Down, 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 touch the floor, pull myself back up. Now, as always, we check out what it looks like properly, and then if it's a fail, there's a few points where people fail on here, and I'll go through them. So one of them is that they cannot keep the fingers interlaced when they go down. They start to do this, right? That's not good. We need the fingers interlaced, the hand interlaced. It keeps that. It keeps the engagement on the shoulder or the position, right? It keeps that constant position. Because if we're having the fingers not interlaced, you're going to be actually holding the shoulders up, and we need you to just relax here, okay? So from here, you're going to go down, And then what else happens is as they get to about here and they start feeling really tight in this side, you'll feel it, this shoulder will peel off. Okay, they'll end up doing this. And that is a big giveaway. If that happens with you, stop straight away, because what we don't want is an overload of sort of this lateral flexion plus rotation. You might do yourself a bit of an injury. So remember, this is a screening tool. If you fail it, stop. Okay? So that are the main points of the failure. And also a couple of other symptoms that are quite common is because a lot of people don't have this mobility as well. So a lot of you will struggle to get into this position anyway, all right? So you might try it like this, although this is a kind of fail anyway, really. But you can try it like this, get your friend to hold it down, get someone to hold the knee down. The weight plate will be harder because it's now at an angle, so as soon as you lean sideways, that plate's gonna just rock off your legs, all right? And then you do the same sort of thing, okay? Right, but we're not getting the same amount of stimulus as we would in that lotus position, which is why it's called the leaning lotus, okay? So what you might feel in this position is that as you do rock sideways, you're going to feel a big pull on that iliotibial band as it comes down round the knee here, okay? So as it comes down, you might find that you don't have the mobility in external rotation yet, enough mobility in external rotation and abduction in the groin to actually keep that position as you go down, which is fine because that's what we're testing for, okay? And so if you do feel that an over pulling here, just stop as well, because if you keep going, you're going to end up getting inflammation in the lateral collateral ligaments, and that if you push it too much, that takes ages to get rid of. All right. So that is the leaning lotus. That is the end of the upper body drills. Tomorrow we move on to the lower body. If you like what you see and you want to find out more, check out www.thereprogramonline.com. Check this out. Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong, athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.